So one of the most important reasons of breast cancer is, first of all, the number of babies. Like today, everybody has very few, either one or two baby. More number of babies, more they suck the breast milk, and less chance of breast cancer. Because breast cancer develops inside the milk duct.
So many girls nowadays they are not ready to give the breast milk. They always used to take the external the cow milk and something. How pain can be a god as compared to the pleasure. How sorrow can be a god when people are looking for the happiness in and around. How when a doctor is treating a patient, apart from the treatment, how a doctor can treat a patient holistically.
That's what. So when you know that cancer is a genetic disorder, we have millions of genes, and some of the genes cause this cancer. That's why, because cancer is a disease which is basically involving the entire life, the life philosophy, life, everything of life it touches. And one of the cause of cancer is this anxiety and problem. So there is no solution of thousands of problems what we face every day. But just imagine one hymn of Upanishad, one shloka has solved all the problem.
Which one, sir?
And this shloka is Isham Aishwamidam Sarvam Tat Kinchit Jagatang Jagat Teno Taktenu Bhunjita Ma Kinchit Pushachit Dhanam. When a cancer patient comes and meets us, they're so depressed. Say in the prime of life, around 40-45 years of age, a person got cancer. He is not settled in life. His children are small. They are in the school. He just purchased a flat by taking loan. So, his life has just started, and in that scenario, if he gets a deadly disease like cancer, where survival is very poor, you are the Lord of all the rivers that flows. You are the Lord of all the creeper that creepeth. You are the Lord of all the fowls that flies. You are the supreme. Your only aim in life is to meet me.
Hello everyone. Thank you so much for joining for this wonderful podcast. Today we have our podcast guest Dr. Somrat Bhattacharjee, and Dr. Bhattacharjee is a senior oncologist, especially treating the cancer patient not only in India, across the world. And he is more than an oncologist, I should say, because I am really impressed and mesmerized by the way he's a very good storyteller, and he is the one who can really touch the hearts of the people. और इसीलिए होता है सर कि आपके पास में जो पेशेंट आते हैं बिना आपसे मिले ट्रीट हुए आपसे बात करके उनको सेटिस्फेक्शन नहीं मिलता है.
Correct.
So I was talking to Dr. Bhattacharjee regarding many aspects of life, and certain the points and the thought processes what he shared from his wisdom and the experiences, which is really amazing and very rarely seen in this community. Sir, welcome to this podcast.
Thank you. Thank you.
So बताइए sir, what are your views about the life? Let's start from there.
See, I am practicing for last 40 years in cancer field. From 1986, you can say I started my journey, and I have seen lots of patients in different parts of the country and abroad. Now, the most important thing is, first we should understand what is this life, because cancer is a disease which is basically involving the entire life, the life philosophy, life, everything of life it touches. And honestly, after treating so many years, I have found that cancer is a small disease. We fear it, we give it a lot of importance, but actually it is a small disease. Our human spirit is much more than a cancer. We can conquer it easily. Now, first we should understand what is the basis of our life. Now, let me go back to Upanishad. I am a follower of Upanishad, the Indian philosophy, the life of India is there in Upanishad. So, there are different parts of Upanishad. First part is known as Ishopanishad. Now, today in the world, we are suffering with so many problems And one of the cause of cancer is this anxiety and problem. So there is no solution of thousands of problem what we face every day. But just imagine one hymn of Upanishad, one shloka has solved all the problem.
Which one, sir?
And this shloka is Isham Aishwamidam Sarvam Tat Kinchit Jagatang Jagat Teno Takteno Bhunjita Ma Kinchit Pashyachit Dhanam. This means Isham Aishwamidam Sarvam. In this world, whatever you are seeing is God. It is not godly, it is God. Tat Kinchit Jagatang Jagat. Even the smallest thing what you are seeing, like a sand, that is also God. Your sorrow, that is also God. Your all happiness, that is also God. You achieved something, that is God. You have not achieved, that is also God. So whatever your helplessness, your depression, actually it is God. You are getting God in a different form. So that's what they are telling. Tat kinchit jagatang jagat. Teno takteno bhunjita. You enjoy by sacrificing. Suppose I give you a sweet, you take it and you enjoy it. But I give you a sweet, you gave it to somebody and enjoyed more. That is known as teno takteno bhunjita. You enjoy by sacrificing. Ma kinchit pashyachit dhanam. Never get disheartened because nothing is there to be disheartened. Disheartened itself is God. You are getting God in a different form. So this is the Indian philosophy.
This is quite contradicting, sir. How pain can be a god as compared to the pleasure. How sorrow can be a god when people are looking for the happiness in and around. So, and you said your statement that cancer is a very small disease. How when somebody is suffering from cancer, the kind of the problem and the atrocity people goes through, it is really very very painful to see them. How you can substantiate that the pain is also God.
See, the point is what we mean by God. You know, in the Bible, when the world was made, the God told all the sons of God should for joy. The Gabriel, who was the incarnation of God's follower, he wrote, morning stars sing together, all the sons of God should for joy. This means the God has decided that every human being should enjoy. He should be joyful. But what we have done to ourselves because of our greed, because of our all these, earthly desire, bad desire, desire for power, we have destroyed the main idea of God. We have ventured something which He told you, please don't venture. We went for the apple. He told again and again, don't take this apple. But due to the effect of, Mephistopheles and all, we took that apple and today we got Adam's apple, got detected that we have done wrong. And then he cursed. He told you should earn his bread by the sweat of your brow. This means we ourselves, because of our sinful act, because of our greed, because of our greed for the power, we ourselves are destroying our future, our life, our all ambition, our joyfulness, which was offered by God. Today, what Gita tells, Atmanang Vidhi, know yourself. See, your actual essence of the life is inside you. God has concealed it in you, and you have to venture it. You have to get that essence. So don't look outwards. Don't see what others have, I don't have. You turn your vision towards yourself, and inside you is the essence of life. That is what the God has planned. But why we suffer from sorrow? Because it is created by us. God never created sorrow for us. He wanted us to enjoy the world, enjoy the whole life. What He told at the time of creation, you are the Lord of all the rivers that flows. You are the Lord of all the creeper that creepeth. You are the Lord of all the fowls that flies. You are the supreme. Your only aim in life is to meet me. But where are we? Where we are looking to God, the divine power which is always embracing us. We never look for that. We're always going down. Our look is never up. Our look is always downwards. And because of this wrong look, because of wrong direction, wrong plane, wrong aim in life, we suffer wrongly. Otherwise, God has never desired that we should suffer. So today, why we are suffering in this world? Because we are away from God. More we are away from God, more is the suffering. So because of this, why I told everything is full of God, what God has planned. God has never planned sorrow for us. God has never planned depression for us. We are the supreme creature of God. Srinantu Vishya Amritashu Putra. आज दिव्यधमानितस्तु विदाहमेतत् पुरुषं मान्तो आदित्य वर्णं तमसा परस्तात. What our Hindu philosophy is telling, Srinantu Vishya Amritasya Putra. O the son of nectar in the world, you hear me. Aj Dibbadamamitastu. I am coming to tell you the story of that huge person, that Purushottam, the ultimate Purush, or that God. Vedaham etat purusham mahanto. He was described in the Vedas, Aditya Varnam Tamasha Parastat. His color is like the sun, thousands of sun, and he is above all darkness. So we are the son of that supreme power, that creation. But where we place ourselves today, we place ourselves in a very funny position where we have no aim, no look, no future. We look downwards, always towards the destruction. So that is our problem. That's why we suffer. That's why we suffer.
Sir, you got so much of wisdom. How do you remember all these shlokas and everything, sir?
See, the point is when I read these slokas, actually I correlate with my own life. See, I correlate them how they are so practical. Because the moment you feel yourself that I am the son of a God, then you feel that you are elated. Like Bible is telling, you are the sinner. So the moment a person here, I am a sinner, he's automatically his mood, everything comes down. But actually he is not the sinner, he is the son of nectar, he is the son of Amrita, who has no death. So the moment you feel that, you yourself feel elated, your spirit goes up. So when I read this thing and I correlate with the human spirit, then I really recognize how important they are. That's why I remember.
Very nice, sir. How this helps in terms of your day-to-day practice while you are treating the patient?
Yeah. So this is a very important part. See, when a cancer patient comes and meets us, they're so depressed. Say in the prime of life, around 40, 45 years of age, a person got cancer. He is not settled in life. His children are small. They're in the school. He just purchased a flat by taking loan. So, his life has just started, and in that scenario, if he gets a deadly disease like cancer, where survival is very poor, he may live for another, some maximum 5 years, 10 years, nobody knows. How depressed he is, he got mentally sick. Many of the patients get psychiatric problem. So, when in that situation, they come to us, they are very helpless. So, the issue is, when this type of patient meets us, then we should be very careful in dealing with them. First, we should elevate their mental power, mental position. We should elevate our mental position, patient's mental position. Patient should feel that they will be healed, they will be cured. That message is very, very crucial, because I have discovered a medicine during my research in cancer. What I have found, in human body, there are a type of cell which are known as natural killer cell, NK cell, and they are in our immune system. So normally these cells are sleeping. But the moment you increase your mental power, the moment you feel that, you can stimulate yourself, you will be 100% all right from the disease. Cancer is a small disease. Your human spirit, your human power, your ambition, your achievement are 1,000 times higher than a small disease like cancer. How cancer can depress everything? How cancer can destroy everything in you? You are 1,000 times above the disease. So when you stimulate yourself, these NK cell, they get stimulated and they releases chemicals which kill cancer. And in my laboratory studies, in experiments, I have found that these chemicals are interleukin 2, interferon gamma, tissue necrosis factor alpha. I have seen them in the lab and they directly kill cancer cell. So when God has given you so much power to kill cancer, why you are not going in that way? Why you are feeling you are so depressed, so upset? More you are mentally strong, more natural killer cells will be stimulated and more it will release the chemicals which will kill cancer. So God is giving you the power to kill cancer. Please utilize it. So that is my first lesson to my patients. And it really helps. It is not just a consolation. It really works.
What are the certain practices, sir, if cancer patient follows? Then the very good correlation you said that we already have NK cells. Now to stimulate the NK cells, how someone can really increase their own confidence. There is a case study. I think there is a statement of Dr. Devi Shetty. He said that there was a person who asked him the question. There's so many patients comes to you with so much of heart problems. Some patient after you operate, they are very well treated and they are very go with the healthy sign and everything. Some dies there. So his reply was, it's not me. I am just there. I do not differentiate between the patient, but what they think.
Exactly.
Some people, those who think that yes, I will be all right after his operation, they survive. And those come with the very negative thought and those do not have any hope to survive. They
Correct.
die over there. So this again, endorse your statement here, sir.
See, the point is every human being is different. Everybody's mental strength is different. Some people, though I stimulate them mentally, but they cannot stimulate themselves. They may not be so strong mentally. I have many patients in my long history, long journey of 40 years that they came in the last stage to me, and after these lessons, this practice, they are living for more than 20 years. Still today, they are living and communicating with me. So it depends on the level of your mental power, mental strength, how much you can exert yourself, how much you can feel that I will be 100% all right. And more you feel from heart that I will be 100% all right, you will be all right. This is scientifically proven.
Yeah. Sir, this is amazing. And if you can share certain practices to the people, especially the cancer patient, those who are on chemo, medicine, as well as for the surgery and everything, right? What are the few small practices they can do in your day-to-day life, which will enhance their level of confidence and which will simultaneously help them in terms of activating these all cells?
Okay. Now, first you should know what is the latest theory of cancer development. Till today, we exactly don't know how cancer develops. Suppose in a house, 5 people are living, getting same food, same environments, but suddenly one person develop cancer, not all 5. Why? Why some lady who never smoked a single cigarette got lung cancer? When we tell that lung cancer is caused by 20 cigarettes per day for 20 years. Why suddenly some small child, 6 months baby, 1 year baby, they got cancer? The reason is cancer is such a disease which starts developing when you are in the womb of your mother before birth. So there is a gene in our body which is known as oncogene. Onco means tumor. So the gene which is related with tumor, that gene is there in everybody. Only when this gene gets activated by some power, it may be some insult, it may be some terrestrial radio wave or some other waves, alpha, beta, gamma, which are running in the universe. It may be due to even Sandre causes cancer, even food causes cancer, even ink by which you are writing that can cause cancer. Virus causes cancer. So there are n number of things which can cause cancer.
Is it idiopathic, sir?
Huh?
Is it really idiopathic, or we can know the reason also? What was the
See,
reason?
some studies have been done in US. They found 20 cigarettes per day for 20 years definitely causes lung cancer. But again, it is, I am telling you, nobody exactly knows why it develops. But what is the latest theory? What I am telling, that is known as Knudsen hypothesis. So So Nordstrom hypothesis tells before the birth of the person, he contracted something in the mother's womb, he'd get genetic insult, and that starts oncogene in the process of mutation. But that mutation is not sufficient to cause cancer. So with that mutation, the baby is born, and then he is waiting for the second genetic insult. And you don't know, it may happen at 6 months, 6 years, 60 years, 90 years. The moment the second insult happens, then active cancer starts. So that is the reason why cancer starts in a person also. It is not all on a sudden. It is already decided in him before his birth. That's the reason suddenly we see somebody develop cancer.
So, very, very good, sir. Thanks for sharing this. Now, how when a doctor is treating a patient, apart from the treatment, how a doctor can treat a patient holistically, sir?
That's what. So when you know that cancer is a genetic disorder, we have millions of genes, and these some of the genes cause this cancer. That's why today, for cancer treatment, first thing what we do is we study the genes. There are very, very important tests like 500 gene test and all, which tells exactly which genes are causing cancer in a particular patient and what is the remedy. Even the gene tells us what is the treatment. That's why never start treatment wrongly. See, in cancer treatment, first treatment is the best treatment. So when you start the treatment, get accurately to the thing and start the right treatment. So that is very important for cancer management. So the issue is today when we see a patient, we always try to locate what is the exact cause of cancer, even by genetic and other methods. And we start to treat in the right way from day one. And that is the actually secret of success. If you give the treatment right way from day one, you can achieve your goal easily.
Excellent, sir. Which type of cancer is more prevalent, and especially in the male or female? And what are the few causes, especially for those kind of cancers, sir?
See, in female, the commonest cancer is breast cancer, and also cancer of the cervix, that is the uterus, that is in the village people, the non-urban areas. So this is the commonest, but urban is breast cancer. So one of the most important reasons of breast cancer is, first of all, the number of babies. Like today, everybody has very few, either one or two baby. More number of babies, more they suck the breast milk, and less chance of breast cancer. Because breast cancer develops inside the milk duct.
So many girls nowadays they are not ready to give the breast milk. They always
Exactly.
used to take the external
So the issue is, see, the breast cancer, one of the major causes, it is introductal inside the milk duct. So more baby sucks the milk, the duct remains clear. So that is one of the reason today in abroad they don't like to wear bra and all this thing, because it presses the nipple, so it does not allow the secretions to come out, and that may be one of the cause of breast cancer.
So bra should not be
Very tight bra should not be used, and many people, many women, they don't like bra nowadays too much. There is also scientific, because it suppresses the nipple, so the secretion cannot come out properly. So one of the cause may be this less number of babies.
Yeah.
And again, another important fact has been found: those ladies who had hepatitis B before, they have more chance of breast cancer than those mothers, who are wet nurses. They have more chance of breast cancer.
What is the meaning of
Wet nurse means those who give milk to other babies. Suppose a mother delivered, but she has not sufficient milk in her breast, so she can take the help of another lady who is lactating. So that lady can give breast milk. So those are known as wet mothers or wet nurses. So sometimes there is a high risk of cancer in them. And another very, very important thing is hormone. Abnormal use of hormones, like suppose infertility, they give hormone therapy. These are very dangerous. This causes definitely high risk of breast cancer. So nobody should use hormones abruptly. These are very, very dangerous for developing breast cancer. So like that, there are some causes which has found some correlation. Then another very important fact is a mother, suppose in a family, a mother is having breast cancer, grandmother had uterus cancer, somebody had cervix cancer or ovary cancer. In that family, there is a high risk of cancer. So like that. So it has a definite correlation genetically as well as environmentally and many other psychological factors. Today, why females are getting more? One of the major cause is stress. Because there is a very beautiful study they found in blind people who are blind from birth, the risk of cancer is very low.
What is the reason, sir?
Reason is eye is one of the main source of anxiety because we see things by eye. So this vision, the sight, gives lot of irritability, lot of mental anxiety, lot of problem in our mind, and that may be a cause of cancer. That's why they find the people who are blind from birth, they don't get cancer or very less. So like that, there are various studies which shows that anxiety is a major cause of cancer today. So these are also related with modern life. Then our food, junk food. I have some 4 or 5 young patients from the age of 22 to 28 years, female. They work in the night in the all these call center and all. That can lead to, and they take junk food. That is very dangerous. This causes rectum cancer.
Any specific food, sir, which is the main reason for this?
Basically, these junk foods at night, what they order and take.
Pizza, burger.
Yeah, these things are very dangerous because when you are not sleeping at night due to your profession, your circadian rhythm changes, and that circadian rhythm change causes tremendous pressure on the body, and over and above you are taking junk food, so this can lead to all these rectum cancer, colon cancer, all these things. Another thing is air hostess, those air hostess who run in international flights, long distance flights. They, what happens, they go very high up, some say 60,000, 70,000 feet above the ground. So they get the terrestrial ray, and they have a high risk of breast cancer.
This is a new information for me. So for our viewers, what is circadian rhythm? Circadian rhythm is when you do not behave, when you do not make your routine as per the nature. What is nature? Morning you need to wake up, evening you can sleep, and something like this. This is called a circadian rhythm. I'll open.
ওইটা বন্ধ করে দাও, আর শব্দ একদম শব্দ করো না। নো নো নো,
আচ্ছা,
it is a mobile.
I thought that somebody can.
No. So
that's the circadian rhythm. When the night is for sleep, if you don't sleep, you sleep in the day. Especially for people those are working in the night shift, they don't follow the circadian rhythm. And another important thing, when you wake up early in the morning, you see the secretion of the hormones, especially the steroids, are more at the peak in the morning hours. So these are called the circadian rhythm. When you do not follow the nature's law and what is normally made by the nature, and
nature will take revenge.
Yeah. Yes, sir.
Yeah.
So please carry on, sir.
So what I'm telling, that suppose in uterus cancer is common where there are more childbirth. So if a lady delivers more number of babies, more risk of uterus cervix cancer, because during birth of a baby, especially normal delivery, lot of pressure falls on the cervix. So because of this pressure regularly, they get more risk of cervical cancer.
So it means that in the Muslim population, cervical cancer prevalence is more?
Yeah. Okay. That's why in village population, cervical is number one. Then virus, herpes virus is one of the cause of cervix cancer. So they have found there is a definite correlation with something, but mostly it is very difficult to say. Even papilloma virus causes cancer. In oral cancer, we see human papilloma virus. So there are the herpes virus. Then there is hepatitis B virus. If a person has hepatitis infection, he may get liver cancer at some point of time. So like that, different virus causes cancer. So there is no limit of the number. N number of causes causes cancer.
So suppose if in a family, the grandmother and grandmother, they were having cancer, For the current generation, what are the few precautions if we
Yeah,
keep from the birth, or maybe at the growing age, there will be chances that
yeah.
it will not.
So actually, what happens? Suppose I told you, if a mother has breast cancer, grandmother had cervix cancer, some aunt, say father, sister had some uterus cancer. So there is a high risk of ovarian cancer in the siblings or in the descendant, her daughter.
Yeah.
So because these are all hormone related. So like I have a family where six sisters are there and all six has breast cancer. So the youngest sister's daughter, she is under tremendous risk.
Mm.
So from the age of, say, ideally breast cancer starts from the age of 40.
Mm.
But I have suggested her from the age of 30, you go on with mammography.
Mm.
Test your breast once in a year at least, either by sonomammography, by ultrasound up to the age of 40,
Yeah.
or by mammography after the age of 40. Go on, and you, any moment we can detect it very early by
Mm.
a score which is known as Byrer score. So if barrier score is 4 or above, there is a high risk of cancer. So this can be detected very early. So this is one of the way how they can check their mammography or sonomammography and regularly put them, regularly train their body or to find very early stage of cancer.
So especially for the people those are in the villages, they don't want to come to the hospital for the mammography, that diagnosis. What is the normal way of checking,
Yeah.
the especially?
So the WHO has made a beautiful program which is known as breast self examination.
Hmm.
And they told from the age of menarche, like when you start your menopause at the age of 14 or 15, till death, because more the age advances, more risk of breast cancer advances.
Hmm.
So, till death, uh, you have to do breast self examination. Now, what is breast self examination? During taking bath, just open your upper part, see the two nipple, join in the mirror and join by an imaginary line. If that line is parallel to the ground, there is almost no risk of cancer.
Oh.
Why we say so? If cancer happens in one breast, either the nipple goes up or goes down. And so that line will join the
Hmm.
ground.
Hmm.
It will be never parallel.
Okay.
So this is one way how you can detect very early breast cancer. Or there is a lump in the breast. If the lump is more big in size, then obviously you have to go for a doctor to do biopsy and all.
Hmm.
But if you find a small lump which vanishes
Hmm.
after pressing on the waist, you put your hand in the waist and press it tight,
Hmm.
make the breast tight. If the lump vanishes, this means a high risk of cancer.
Oh. Hmm.
So these are the various tests. 10 tests are there.
Yeah.
By you can easily do during in your bath and all.
Yeah.
You can easily detect very early some doubtful thing. Then immediately go to the doctor and find it.
Hmm.
So
So
this is one
compared
of
to
the.
men, the hormonal changes are happening very frequently in the woman, because the moment they achieve their teenage, the hormone secretion changes, marriage and having kids, after that, the menopause. So there are multiple up and downs in the entire, the hormone secretions and this all things. And that is why probably, more chances are there in the woman. Is there any study, sir, which says that,
Yeah, because actually what happens, the females are more under control of estrogen and progesterone.
Hmm.
And estrogen, progesterone, as long as it is in high level, there is a risk of breast cancer
Mhm.
more.
Yeah.
So up to the menopause, estrogen, progesterone levels are high.
Mm.
So obviously the chance of cancer is high, especially breast cancer. So ideally, one should not, be this thing take extra hormones or be very careful in taking hormones, which can lead to. I have many patients
Mm.
who got breast cancer after taking hormone pills
Mm.
for many other reasons. So these are very important because once their hormone is controlling breast cancer, hormone stimulates breast cancer. So one should be very careful in hormonal level and everything.
How about the any relationship with the cosmetics ladies or girls are using while school going, college going girls, especially for the models, especially in the fashion industry, or is there any correlation with this, sir?
See, as such, she is making some sound. That is not
No, no
causing it.
problem.
As such, there are no direct correlation, but what we have found, those people who use shampoo, no, they shampoo the hair and all these things, there is a risk of pancreatic cancer
Oh.
with the chemical of the shampoo.
Hmm.
Even many people use tar who are having connective tissue disorder
Hmm.
in the sole of the foot. They use tar. Tar is directly petroleum product.
Hmm.
This can lead to cancer. There are various defective chemicals or very dangerous chemicals which can lead to cancer. So ideally, one should not use these chemicals as much as possible. See, one of the problem of our people, especially female, is they feel if I am fair, my acceptance will be higher. Like always, people are after white skin.
Hmm.
But see, it is a different thing.
No problem.
There is it's a different thing because of the environment, because of the nature.
Hmm.
Like we are in tropical countries, here the sun ray is very dangerous.
Hmm.
It can lead to skin cancer. So God has protected our skin by melanin pigment,
Hmm.
and melanin makes us black.
Yes.
So it is your protective cover. A British or an European or an American does not require that melanin. There the sun ray is not that dangerous because we are in tropical country. Our here sun is directly giving the ray. So their skin will be less melanin. So it is less protective. That's why in Australia they get skin cancer very high
Hmm.
because of this.
I think a lot of contribution from Bollywood also made. गोरे रंग पे ना इतना गुमान कर गोरा रंग गोरा रंग गोरा रंग
This
उन्होंने
is
ये this is
this
something.
is a myth, and actually this is a very false feeling that if I am fair, I'll be more accepted.
Accepted. Yeah.
So actually, this is harmful because you are making your skin more harmful by the chemicals. These chemicals have very long-lasting effect. Even they enter into the blood through the skin, and they can damage your kidney, they can damage your heart, lung, everything. So it is always better to avoid this thing. Be natural.
Yeah. Sir, in males, apart from smoking, what are the other very common causes?
One of the major causes is alcohol, because the agents, chemical agents which causes cancer, these are known as carcinogens. And these carcinogens are mostly water soluble. So those who are water soluble, they obviously enters the body and cause cancer. But some of the chemicals are fat soluble. So like if you take only cigarette, definitely you will suffer. But if you take cigarette and alcohol together, then you suffer more, because there are many chemicals, almost 4,000 chemicals in the cigarette smoke which causes cancer. 4,000. Many of them are fat soluble, which will be dissolved in the alcohol and it will go into your body.
So yesterday I was talking to one of my colleagues, sir, outside the office, and he was doing vaping. And I asked him, why don't you smoke? You are doing vaping. He said, no, vaping is more safer this compared to the smoking.
Nothing.
And he was sharing some case study that in Japan, somebody's father was using smoker and he discovered this and that, and they are giving their own logic. Another thing, one more friend, sir, his uncle survived around 90 years and he was smoking. He was giving always the reference. My uncle was smoking, 6 to 7
See, that is the reason I told you.
Yeah.
The oncogene shows at your time of birth what is the level of your oncogene structure, DNA structure.
Yeah.
If the DNA structure is incomplete, then nothing will happen even if you take gallons and gallons of alcohol and cigarettes, like bundles and bundles, because that incomplete gene will not be completed in your lifetime. But if your DNA or genetic structure is almost complete at the time of birth, then without anything also you can develop cancer, because any time that gene structure will be complete and cancer will start. That's why it depends from person to person. What is the level of gene at the time of birth? It is not what he does. What is the level of the gene, genetic mutation at the time of birth? If it is almost mutated, there is high risk of cancer within a short time. Yeah. Whereas if it is not mutated, whatever he does in whole lifetime, cancer will not happen.
Let me ask you one contra question, sir. I come from pharma background. As you know, we both are from pharma background. So pharma companies, they conduct a lot of CMEs and all. And after the CME, what happens, there is a cocktail party and cigarette and whatnot, everything. Most of the doctors, they are asking, if there is a party, if there is a this brand is available, then only I will come. So even though understanding this, and then is it because of habit or because of what, they themselves thinks that we'll be relaxing at that moment, at that point of time, whenever there is a party.
See, the point is why people take substances.
Mm.
Like people take cannabinol, that is ganja,
Mm.
marijuana. Why? Because in the brain, the cannabinol is this is produced. Brain has that capacity to produce the same chemical which comes from cannabinol.
Is it?
Yeah,
Oh.
this cannabis produces cannabinol, and that cannabinol is produced in the brain. So that causes healing from pain.
Mhm.
So same mechanism we take from outside, but the problem is when we take from outside, we take more.
Mm.
That's why we suffer from all the other side effects. Similarly, nobody knows which way to get relief or get peace.
Mm.
Somebody thinks if I take cigarette, I'll be peace, I'll get peace and relaxation. It is wrong actually. It is a wrong psychology. You don't get peace or relief by taking cigarette. Cigarette damps
Mm.
this, the thing in the cigarette, nicotine, it damps your some of the feeling. So you feel it, I am relaxed, but actually you are not relaxed. It is a wrong feeling. Similarly, alcohol, people think I may be relaxed because I'll forget the worries and all. It's another wrong feeling. The actual feeling is different. That's what I told. You go to God, think positive. Your relaxation will be thousand times more than all these things,
Mm.
substances and alcohol and all these things. They can never give you the actual relief feeling, peace of mind. What you get in meditation, you can never get in all these things.
Yeah.
These are all wrong belief, wrong faith, and that's why wrong dependence. They can never give you the actual this thing.
Yeah.
That's why I told at the beginning that just feel you are the son of nectar, Amritashya Putra. Why you require all these bogus things?
Mm.
God has given you, God has made you the supreme creation. So why you are to look like a, drenched person, depressed person, unholy person? Why? Why
Mm.
you require this sedation and all? Like I remember one scientist in US. I went for a conference, so he asked me a simple question. Actually, he is the director of one of the best center of this liver surgery,
Mm.
liver transplant in Barcelona. He is the director. So he asked me one question, Ki Bhattacharjee, tell me, I have many students from India, from US, from Japan, from England, who are doing training under me for liver transplant.
Mm.
I have seen a very interesting thing. The Indian students, suppose they are working hard, very hard for something, for some result or some promotion or something. Suppose he has not got it. He gets depressed. 2 3 days he'll be very depressed, but then on fourth day he says, it is not in my fate, what to do, I have to start again.
Mm.
So again he starts with full enthusiasm. Whereas an American fellow, if he does not get 1 month, he will be down with alcohol and all this thing, he will never come near my lab only, then slowly he will improve. It is if it is a Japanese guy, I am very worried he may commit suicide.
Oh my God.
So why in Indian students
Mm.
they can revive very fast within
Uh,
3 4 days they are back to their work.
uh,
I told because our life is on Upanishad, our religion is our basis of life.
yeah.
What is dharma? Dharma means which holds.
Mm.
Jo dharan karat means which holds you. That is dharma. That is your base.
Mm.
So our Indian philosophy is very simple. Karmanya vyadikaraste ma phaleshu kadachana. Your right is in work, not in the result. You don't know what result will happen. What you can do, you do your job 100%.
Uh,
Ma Phaleshu Kadachano, never think of what I'll get.
yeah.
Your right is in karma, in the work. So same philosophy which has hold us. So that's why we are never depressed.
Mm.
Maybe, yes, obviously, if I have tried a lot for something I have not got, obviously I'll feel bad.
Yeah.
But then our religion teaches us, no, you proceed with more vigor, more courage. Failures are the pillar of success.
Yeah.
So with the failure, you get the knowledge, and with that knowledge, you proceed forward. So it is depending on the mentality. So don't go into these small substances that can never give you the actual peace. Actual peace is in positive thinking. Actual peace is in Upanishad. How many of us today we read Upanishad, Gita, these are the Vedant, which has given enormous knowledge. Why in Germany they are made for our Sanskrit? Because they found this is the only language in the world where every word is unique. Every word is unique. And they are making a supercomputer where the language is Sanskrit in Germany. Why? Because they found the essence of life is there. Today, Russia is made for Gita. Why? They found in Gita the actual message of the world is there, actual message of life.
Sir, today, I think yesterday only, Narendra Modi gifted Bhagavad Gita
Gita.
to Putin.
Yeah.
And it was in the Russian language.
Correct.
And he was very happy to receive that. And Gita never he said that it is only for Hindu or
nothing. It is the basis of life. Gita is not a religious book. It is a basis of life. See, Krishna, he told very simple thing. Always think of me. And me means divine, the superpower. So always think of the superpower. You are the disciple. You are the descendant of that superpower. So why you have to worry for some small things in the world?
Excellent, sir. Sir, last birth karmas has any effect?
Yes.
What is that, sir?
See, it is written very clearly. Jatasya hi dhruvam mrityu dhruvar janmo mritasya cha. Whoever has taken birth, he must die. And whoever is dead, he must reborn. So it is the rule of the world. Because energy is constant. So if somebody dies, where that energy goes of Atma, so again it recircles, again it will come back. That's why it says, Jatasya hi dhruvam mrityu. The person who is born, he must die. Dhruvar janmo mritasya cha. That person who is dead, he must reborn. That's why we get so many histories of previous birth. There are many histories where people tells of the previous birth. This is because it is a cycle. So it can never. It is Atma is avinishar. Atma cannot be destroyed. That shloka is there. No shastram vidyate, no chiddati pavako. So this is the Atma. So how Atma can be destroyed? So it is an energy. So it is recycle. It is always cycling.
Atma ajar hai, amar hai, usko jala sakta hai,
correct.
Usko kar sakta. Very good, sir. So we have touched a lot of spiritual points and the medical science along with.
They are together. It is entire thing is a mixture of both. So more you understand that, you will understand this.
So I'm very.
See why Einstein told, where science ends, philosophy begins. Because he found that by science I cannot explain everything. I must take help of philosophy. So this is the thing. We have to mix both together.
So where science ends, these all philosophy and spirituality begins. Wonderful, sir. Is there anything we are missing talking, sir, for the benefit of our viewers and from your depth of wisdom, sir?
See, another thing what I personally feel and like is we must try in different subjects. Allopathy is one of the subjects, but allopathy is not everything. There are many other sciences, like there are sciences like from flower you can get treatment. This is color. This is different types of flowers are available in the wild of Scotland. By that they treat patient. Okay, then there is these acupuncture, acupressure, Reiki. They are all scientific. So there are even by music you can treat cancer patient. Music therapy. Even there are many other therapies. Touch therapy, contact therapy. By touch you can cure a patient. By absent therapy, suppose I am sick, somebody is praying for me in US, I will be all right. This is known as absent therapy. All these therapies are there. So don't say that only allopathy or only something. There are many therapies.
You are talking about some hypnotherapy also.
Yeah.
What is that, sir? Can you?
So actually, there is a therapy, hypnotism, medical hypnotism. Suppose some people, they see very bad dreams, and in the dream they just come out with severe fear and all these things. So if it goes for a long time, they may be abnormal psychologically. So those patients, how you can treat? So you can make them sleep, and then you can enter into their sleep by hypnotism. So whatever good thing you will feel, or you will think he will see the dream of that. That way you can cure them. So this is medical hypnotism.
Yeah.
It is a treatment.
Wonderful, sir. So thank you so much for sharing, all the lovely things, sir. And especially what is really touching my heart, you are the very good culmination of spirituality and the medical science, sir. And which is
No, I have seen the essence,
Yeah.
how it helps, how it makes your life more comfortable to spend, how it eases your tension of life. There are should be some soothing effect in your life, no?
Yeah.
There should be some agents which should soothe your life.
Yeah.
Like I remain very tense with thousands of patients who are very, very advanced cancer. Even I don't know in many cancers what treatment to be given. So I always remain tense because any patient anywhere can call me and ask me the solution all over the world. So the issue is, but in that tremendous mental stress also, I always remain cool. Because these inner energies give me a lot of strength, inner feeling of Gita Upanishad. Everybody should read Gita Upanishad Vedanta. Then your life philosophy will change. You will feel how vast this life is, how you are blissful to get this life, how much power God has given to you to cure the world, not only from cancer, for so many thousands of calamities, you can save the world.
Yeah.
And that power comes from these Upanishad, Gita, Vedanta, everything.
Yeah. So find every day, celebrate each and every moment in each and every day. There is a dialogue from Anand movie. Babu Mushair, जिंदगी लंबी नहीं जिंदगी बड़ी होनी चाहिए.
Exactly.
So probably we are celebrating this discussion and conversation, and I always rejoice and enjoy talking to you in office or wherever we meet, sir. And always love to accompany you for such a wonderful discussion, sir.
Thank you.
Thank you so much, sir.
Thank you.
So guys, thank you so much for watching this. If you are watching till now, please share this with all your friends, family members, and the society and the community people, and make sure you benefit out of it. Thank you so much. Subscribe कीजिए और देखते रहिए Dear Life by Pankaj Sharma. Thank you so much.
Thank you.